an accident, a complication during surgery, an unexpected reaction to medication. Any number of things can land a patient in intensive care. Medical science has developed an array of procedures, instruments, and drugs to keep us alive. Among the medications intensivists rely on are vasopressors. In an emergency, they're critical.
Un vasopresseur est pour moi aussi essentiel que plusieurs des articles de base qu'on utilise en médecine. Le vasopresseur est pour moi aussi utile que la transfusion de sang chez le patient anémique, que chez le patient qui saigne, aussi utile pour le médecin qui endort les gens en salle d'opération que son équipement de ventilation et ainsi de suite. Donc, je ne peux pas travailler aux soins intensifs sans vasopresseur.
Vasopressors maintain blood pressure in patients whose bodies are in shock and can no longer regulate themselves.
They all have in common the capacity or their effect is always to raise blood pressure when blood pressure is too low, and particularly we use them when we think that the blood pressure is so low that it endangers the patient's life.
Vasopressors are essential, but as in any medical treatment, there are risks.
Autant des arythmies au niveau cardiaque, autant un risque associé d'avoir de l'ischémie ou de l'angine au niveau du cœur, ou le même genre de manifestation au niveau des intestins, au niveau des reins, au niveau des jambes, des bras.
The Ovation Group is conducting research to better understand vasopressors and their effect on different types of patients. The goal is to make the drugs safer to use.
As we use them so frequently in the ICU, vasopressors are probably one of the most common therapies we administer to very, very sick patients, and also because we administer vasopressors probably to the sickest of the sickest patients in the ICU, which means that we have very, very little room for error. Giving just a little bit too much or not enough might make a big difference for one of these patients.
The difference can mean life or death. Preliminary findings suggest that healthcare professionals may improve patient survival rates and long-term quality of life by tailoring doses according to age. But first, the drugs have to be administered more accurately.
We've noticed that it was pretty difficult to adhere, to observe the protocol in place. Regardless of whether we're aiming for a higher blood pressure or a lower blood pressure. This is the wake-up call that tells us that we should probably scrutinize how we administer these drugs the same way we scrutinize so many other things in medicine. So that's applicable immediately. Which blood pressure target is optimal, that remains to be seen, but at least we know we need to care how we titrate these drugs.
Dr. Francois Lamontagne is cautious about the other prospect raised by this study, one that could be major.
In our study, we found that older patients seem to benefit from a more restrictive use of vasopressors, meaning that survival may be improved if we administer less vasopressors to these patients. But again, this requires confirmation in a subsequent larger study.
It's too early to change practices on the wards, but these findings are hard to ignore.
If the data are true, then the impact might be considerable.
A similar study was conducted in France. Researchers will now combine the data from both studies. What will emerge should be the most comprehensive understanding to date of vasopressors.
C'est quelque chose qui cliniquement peut être appliqué aussitôt que les résultats deviennent disponibles. C'est quelque chose qui peut nous permettre d'apprendre sur la meilleure façon d'utiliser ces médicaments-là, puis aussi sur peut-être quelle population de patients devrait avoir des ajustements particuliers pour en minimiser les risques et les complications.
A more ambitious study could follow. This has been a report from Groupe Émulsion.